So we can do the temple now. So in the temple, I'm going to use L. You can also use M. You can also use XL if you want to have bigger projection. The problem is not so much the depth or the concavity. What I want is to have this little bit of a lift of the tail of the eyebrows. So we start with L. L, c'est celui-là. Yeah, we have a color code on the syringes. Right, so remember, give me the skull. If you stay close to the orbital rim here, and that's the lateral side of the lateral orbital rim, this apophyse externe, the external apophyses. If you stay here, you go down to the bone. It's a safe injection. You saw the video, beautiful video of Sophie converser with the cannula. What I want to show you with the needle. So what you do is, this is the angle from the lateral side of the orbit and the linea temporalis, and up you go 30 degrees and you slide on the bone, intramuscular, and my goal is at the angle of the attachment of the periosteum on the temporal crest. I want to stretch this muscle and the aponeurosis to get this projection and this convexity. Are you okay? Mm-hmm. No? So then, when I do one hole, what is painful is the entry point on the skin. Normally, deep is not that painful. So I used to do a fanning, bolus, or pyramid injections. So I'm doing this because I have the camera. Normally, I'm in front of the patient. I'm not twisted like that. So, but for you, I have to remove myself from the camera. Okay, so this is already 0.8 ml. Okay, give me a Q-tip, and I have a little trick. I use hydrogen peroxide on the Q-tip, and that helps if you have some clot or a bit of bleeding. You just put it on the entry point, and thus you wait, and then that's normally stop a bit of the bleeding. So that's the first entry point. Then you can use a second entry point close to this angle. And this is not perpendicular down to the bone. And I agree, if you inject deep, you end up in the fat. And the fat communicate with the buccal fat pad, and you lose your product. So this is more an injection close to the aponeurosis, and intramuscular, but superficial, just under the aponeurosis, deep temporalis aponeurosis. Okay? Right.